Daytime Doctor TV is about to change. The days of traditional dental thinking are over. We're here for dental consumers who are tired of crowns, tired of repeated invasive procedures and dealing with problems in their mouth that seem to never go away. There is a better way. There is an alternative approach leading to whole mouth and whole body health for the rest of your life. Stay tuned to learn more now. This is the Dr. Shoup Show. Here's your host, Dr. Randy Shoup.
Hello, everybody, and welcome to the Dr. Shoup Show. I am your host, Dr. Randy Shoup, and when I'm not in my office at Microscope Dentistry by Shoup, right here in central Indiana, I have the honor of traveling the globe teaching other dentists the ultra-conservative dental techniques that I'm going to share with you. You know, dental schools have been teaching basically the same systems for over 150 years. There is a new way. There is a better way for you to receive the dental and health benefits that you want. I also teach what's called the oral systemic health connection. That's where we know that the health of your teeth and the health of your gums directly impact your overall body health. Did you know that the health of your teeth and the health of your gums has a major factor when you think about your risk for a heart attack, when you think about your risk for a stroke, or your risk for getting diabetes? You know, on this program, we'll bring to you a list of experts discussing amazing topics and giving you information that you're never going to find anywhere else. Information on topics such as osteoporosis. Where does it come from? How do I treat it? What are my alternatives for its treatment? We'll talk about sleep apnea and the quality of your sleep and how much of an impact that makes on your overall health. We'll certainly open the door to nutrition, and we'll tell you that nutrition truly is the key to your overall health for a lifetime. And I'll also be able to tell you that when your dentist tells you, I need a crown on that tooth, or you must have a crown on one of your teeth, they're probably not right. That you can never have to have your tooth ground down to a little nub ever again and have a crown placed on it. And so those are the topics that you and I are going to discuss in depth amongst many, many more. So why don't we get today started, and let me introduce to you the expert that we're bringing to you right now. And it's going to be me. You and I are going to have an in-depth, detailed, truthful conversation about what is really the most cost-effective dental procedure that you could ever choose to have done. It will give you more bang for the buck. It will give you more protection for your teeth than any other dental procedure. And you'll like this. There's no shots, there's no numbing, and there's no drill. How is this possible? I tell you what, stay with me and I'm going to tell you all about it right after this message. Well, welcome back, and I am absolutely thrilled and delighted you are here. I'm going to tell you that I am absolutely speaking from the heart today, because this procedure that I just told you about is one of the most important procedures that I can do for a patient and that you can do for yourself and for your family. It gives you the greatest benefit, the biggest bang for the buck, and certainly the greatest long-term health benefits. And what we're talking about is called pit and fissure sealants. It is a simple concept, and it has been around for a long, long time. It's been taught in dental schools for a long, long time. But the problem is that it has been taught incorrectly. The problem is that it denies the science behind how we know the human anatomy of a tooth works, and it fails on a regular basis unless you do it with great precision, great care, and great specificity to detail. And if you do that, you have absolutely stellar, wonderful results. Here's the thing. 90% of all cavities happen on the biting surfaces of your teeth, on those bumps and grooves on the tops of your teeth. If you count up where you get cavities, that's where they occur. And they're not your fault. The dentist will beat up on you but say, you eat too much sugar, you don't brush your teeth enough, and it's not the case whatsoever. Dentists will actually go in and look at your teeth and look at what they think are stains on the tops of your teeth. And you're going to see some illustrations showing you teeth that dentists will look at and go, well, that's just staining in there. We don't need to do anything about it. And I bet your dentist has even used the term watch on you. He'll tell his dental assistant, write this down and we're going to watch this tooth. We're going to watch this filling. We're going to watch this cavity. My question to you is, what are they watching it do? Are they watching it somehow miraculously dissolve and go away and go back to the regular tooth that it was? Or are they watching it deteriorate and get worse? You know the right answer. They're watching it deteriorate and get worse until it gets big enough that the dentist feels pretty comfortable about having to numb you up, having to drill your tooth out and put a filling in the top of your tooth. I'm telling you, there is a new way and there is a better way of doing it. So as dentists look at your teeth and say, well, this is just staining on the top of the tooth, I'm here to tell you it's actually not. This is what they teach us in dental school. This illustration shows you what the dental schools put in their textbook. It's a picture of a tooth on the bottom right-hand corner, and it shows you the groove in the top of the tooth. And as you expand out the groove, it shows you that bacteria and stuff gets down inside that groove, and that's what starts the decay process. And that part is absolutely accurate and true. The problem is it shows this groove as being really, really big, and it shows this groove as being a nice little V, perfectly formed and excellent. The problem is that's not anatomically correct. This is what's correct. The groove on the tops of your teeth is incredibly narrow and skinny. The groove on the tops of your teeth isn't a perfect V, it actually has a bulb or a ball at the end of it. And down in that bulb or that ball is where all the bacteria accumulate that eat sugar and create acid, and the acid then dissolves your tooth, and your tooth then develops a cavity. So think about it. The only thing your dentist can actually see is the very, very top of the tooth where it's super skinny and super narrow and super small. That's why your dentist oftentimes takes the little metal hook, scrapes and scratches, and pokes at your teeth. And if he can get the little metal hook to stick in your tooth, and you've felt this before, I'm sure, where the dentist pushes the little metal pick into your tooth and he has to tug to get it to come back out, then he goes, oops, we have a cavity here. The problem is the cavity is way far gone. It's far more advanced than what you or the dentist are even anticipating. And why is it far more advanced? It's been allowed to, it's been watched for a long time, and it has developed and grown over a long time. What I tell my patients is this. Let's say you go out in your driveway and you look at your car and you see a real small little area of rust on your fender. You have a choice. You can watch that rust, you can monitor it, you can look at it every day, and you can see if it miraculously goes away, or you can choose to ignore it until it gets big enough that you really need to take it to the body shop and have the whole fender cut away and rebuilt. There's a third alternative. You can, when you first see that little early sign of rust on your fender, you can take it to the body shop and say, hey, can you scrape that off? Can you clean it? And can you seal over it so it won't happen again? And the body shop people will say, sure. See, dentists have never been the conservative body shop people. We've always wanted to wait until things are so big that we've got to pull them into the shop and do major work. So the anatomy of a tooth, how a tooth is actually formed, not the pictures that they show you in the book, but the actual reality of how your tooth is formed is really the determinant factor on your cavities. Here's why. Most of the cavities on the tops of your teeth are not your fault. You've been blamed for them. You've been told you're responsible. You've been told you are irresponsible. You eat too much sugar. You don't brush enough. You don't go to the dentist often enough. And if you were better, if you were a better person, if you were more careful about your hygiene, this wouldn't happen to you. Bad things wouldn't happen to you if you did better. I'm absolutely telling you factually, None of these cavities on the tops of your teeth have anything to do with you. It has everything to do with the anatomy of your tooth, and it has everything to do with what we consume in our Western diets that is so much more acidic than what we're supposed to actually consume, and it has so much more sugar in it than what we're actually supposed to consume that we really don't have a chance. So, dentistry happily invented the pit and fissure sealant system. Now let me actually show you some real human teeth, and these are human teeth that we photographed under ultra-high magnification. And I'll tell you, that's one of the major factors when you have somebody doing sealants on your teeth. If they're not wearing ultra-high magnifiers, if they're just using their eyes, or if they're just using their regular everyday glasses, don't let them do it. It's not enough. But let me show you a human tooth under magnification, and 99 dentists out of 100 would look at this tooth and say, well, we're going to watch this. I don't think there's anything going on there. I think that's just staining. And if we were to take it a step further and say, let's shoot an x-ray of this tooth. Let's see if the dentist can see that there's a cavity there. There's nothing. You don't see anything on the x-ray. It's clean as a whistle. But let's say you take that tooth and actually cut it in two, right through that groove that I showed you that had the stain. Look at that. That brown stuff underneath the enamel right there, that's a cavity. That's a cavity growing in the tooth that the x-ray didn't see and that the dentist certainly would not have ever seen. The dentist has no way. Look at this tooth. It looks really good. 99 dentists out of 100 would look at this tooth and go, this is a wonderful tooth. There's nothing in the world we need to do to this tooth. Let's shoot an x-ray picture of it. Well, it looks good to me. I don't see that you need anything. They pat you on the back and they send you on your merry way, and we'll see you in 6 months. But if they were to look a little further, cut the tooth in two, look at the cavity that's there, hiding under the surface. The only way you can find that cavity and find that decay is by using ultra-high magnification and by cleaning out those grooves, cleaning out those systems, and cleaning out all that bacteria that's down in there, then sealing the tooth. You see, nothing we have will fit down in those little tiny grooves. There isn't a rubber polisher that the dentist uses. You see, it can't fit down inside the groove. Any of the little brushes that we use, that can't fit down inside the groove. So if that groove was filled with bacteria, if that groove was filled with a biofilm that was producing acid, eating away at the deep portions of your tooth that the dentist can't see and the dentist can't access, there's no way of cleaning out those grooves whatsoever. So now our problem is, how do we clean them out? And so I'm going to show you right after we get back how dental schools teach us the wrong way of putting on pit and fissure sealants. And then I'm going to show you how I, at Microscope Dentistry by Shoup, do pit and fissure sealants the right way. And you are going to be totally amazed right after this message. Well, welcome back, everybody, and I am absolutely thrilled and delighted that you are here. I hope you understand, I hope you feel the passion at which I am invested in this process for you, for your children, for your nieces and nephews and grandchildren. This is truly one of the most cost-effective and important dental procedures you can do for these children. When I place sealants the way I place sealants, I expect them to last on these children for a lifetime. I never expect them to come out. I never expect them to need to be repaired. And I have every expectation that these sealants will protect the tops of these teeth for as long as these children are alive. You know, we do a lot of these on adults as well, who are tired of having, every time they go to the dentist, another filling and another filling and another filling. They come in, we put these protective sealants on the tops of their teeth. It completely eliminates all of that conversation. Now, I told you at the break, there is a special way to do sealants that is totally different than how the dental schools have taught us to do sealants. And so I want to play for you a video right now and show you how dental schools teach us how to place sealants. You'll notice in this video that there isn't any protection on the teeth that keeps the saliva or the tongue from slathering itself back on top of the teeth. It's critically important because the saliva is filled with bacteria. Once you clean the top of the tooth absolutely positively has to stay clean. That's why at Microscope Dentistry by Shoup, we always place that rubber dam, that rubber protector over teeth when we are doing our sealants. It's critically important. Second thing is, you remember the anatomy lesson we had in our first segment, and you know that simply by taking that brush and brushing across the top of the tooth, they're never going to get all the bacteria and the biofilm out of those grooves on these teeth. So, when they apply the sealant on top of those teeth, they're simply applying the sealant on top of a bed of living, thriving, acid-producing, cavity-making bacteria. That's not a formula for success. Let me show you what we use. Let me show you how I do it. This machine is an air abrasion machine. It's a fancy name for a little teeny tiny sandblaster. Now, I'll bet in the summer or in the fall, you fire up the power washer and you hook it up to the hose and you power wash your deck or you power wash your driveway because it has the ability to clean out all the nooks and crannies and get all the dirt and all the junk out of all the little teeny tiny crevices. Well, we don't use water with air abrasion. We use actually a thing called aluminum oxide. And aluminum oxide, if you were to pour some in your hand, looks like flour that you're going to bake a cake with. It's ultra, ultra fine, and it's ultra, ultra soft. But if you run it through this machine, through an itty bitty little tiny nozzle, it will sandblast all of the cavity out of the tooth. There's no shots, there's no numbing, and there's no drill. But what you wind up with is a completely clean tooth. Then you can apply the sealant, and then the sealant will stay forever. Let me show you what this looks like. Here's a teeth that most dentists would look at and say, this is just staining, we'll put a watch on it, we'll see what happens, we'll not worry about it, I'm sure there's no cavity there. But when you start ramping up the magnification, when you start looking at the teeth even closer and closer, you start to get a sense that there's maybe more lurking under the surface than was originally obvious. If you have a dentist that wants to do sealants on your teeth and they're simply using their normal vision or their regular glasses, don't have them do it. You need magnification. Now watch how the sand cleans off the grooves, but notice how it actually gets bigger and darker the more the sand goes into the tooth. You know that that makes sense because we saw the pictures of the teeth and we know how down deep in those grooves, it doesn't end in a V, it ends in a bubble. And so watch how the sand slowly removes the bacteria, removes the cavity, little by little, and it's gone. And so on all of these grooves, in all of these pits, you see the little dark dot of cavity. Now it's there, now it's not. The patient's not numbed up, the patient feels nothing, the patient is totally comfortable. And look at the little dark dot of cavity, it's there, and it's gone. Super easy, super clean, super conservative, and now these teeth can have sealants placed on them and the sealants will stay. So as we clean out all these grooves, you'll notice that this repeats itself time after time. Let me ask you, how many of your teeth look like this? How many of your children's teeth look like this? How many times have you had your dentist say, you know what, we're just going to put a watch on these teeth. You know what, I think that's just staining that's on there. And now you're looking at the hole that is left in your tooth after we remove all of the decay that supposedly wasn't there. What if you were to have left this for another year? What if you were to have left this for another 6 months? So this blue solution is actually an etchant. It cleans and thoroughly scrubs the surface of your tooth, kind of like scrubbing bubbles. and then we wash that material off, and then we use a brush, which actually will reach down into the bottom of the grooves, and we place a bonding material, a material that will soak into the tooth, and then here's the sealant material being dispensed down into the grooves. You see it flows about like honey, and it fills all of the grooves. It's tooth colored, so it virtually disappears. The reason that the screen is kind of orange is because this stuff reacts to light. And if we have light on it, white bright light, it sets hard. And you'll see in just a second, once we finish filling the grooves, and it's just that fast, just that easy, we shine a light on it, that material hardens and sets, and those sealants will be in those teeth for as long as those teeth are walking around the planet, for as long as those people are vertical, and for as long as you would ever need them to be. I have never had sealants that place that way leak. I've never had them fall out. I've never had them fail. Look at this tooth. Can you see the white sealant in the middle of the tooth under magnification? That sealant is 30 years old. Look at this tooth. It looks perfect. It looks pristine. There isn't the first hint of a cavity on this tooth. This is a back molar. That's 30 years old. And the last one, here's another lower molar. The white colored sealant, which just becomes part of the tooth, that sealant has been in the mouth functioning for 30 years. They've been chewing ice. They've been eating nachos. They've been eating popcorn. They've been drinking sodas. And those sealants never come out. They never fail. And they never, ever, ever allow the top of the tooth to get a cavity. Now, I'm going to tell you something next that is going to probably let you know how virtually honest I am about this whole process. If you Google search dental pit and fissure sealants, if you Google search dental sealants, you're going to find a big warning pop up about BPA, bisphenol A. All dental tooth-colored filling materials are an epoxy resin base. They're all made of a similar sort of material. Bis-GMA resin, bisphenol resin, they're all resin plastic systems. And there's a particular monomer within all of these plastic systems called bisphenol A, BPA. BPA, in the research and the data, has been shown to affect your endocrine system, the system in your body that produces hormones. And in particular, bisphenol A, BPA, affects those cells that are involved in the production of estrogen. Why is this important? Why is this a major force in the study of bisphenol A? Because bisphenol A, BPA, these resins are used extensively in the food world. They are all of the lining inside of the cans of food that you buy. They're the lining inside the cartons of juice that you buy. They're the lining inside most any and all food-carrying products. And if you put tomato juice, or if you put tomato soup, or if you put grapefruit juice inside of a can, highly acidic things, it tends to degrade BPA, and the level of BPA in those products goes up. So the Food and Drug Administration, scientists, nutritionists, health experts are very, very concerned, because if you get large quantities of BPA in your system, you'll start to produce more and more estrogen. We know high levels, inappropriate levels of estrogen are associated with cancer. So people make the connection, high BPA, high risk of cancer. And so I don't want you to make that mistake, because in the United States, there are no pit and fissure sealants that are made containing BPA. So yes, you can paint the entire pit and fissure sealant world with a brush, but that brush is not really appropriate for pit and fissure sealants. Let me show you simply a few of the organizations that have extensively studied BPA in pit and fissure sealants. These are only a few. And they have all come to the same conclusion. There's virtually no BPA leaching out of pit and fissure sealants. It is not a health risk in any way, shape, or form. If it were, you would certainly not find me using them. I would only use those products that are BPA free. As a matter of fact, there's one manufacturer and one manufacturer alone that has completely eliminated all of the BPA out of all of their tooth-colored filling products. That happens to be the company that I use the most. Now, we have given you a lot of information today, and I want you to know, I want you to go to my video blog at drshoup.com. It is a video blog. You can replay all of these programs because I've given you a lot of information. I've really given you science, I've given you anatomy, and I think probably you're halfway along to having your own dental degree. So that's why you tune into this program. This is the information we give to you that you're never going to find anywhere else. This is the truth, this is the science, this is the reality, and this is why you want to tune in to the Dr. Shoup Show every Thursday here on TV 40. So until you and I have a chance to talk about another super important topic, be sure to brush and floss.